Senator Holly Mitchell wanted to be here today and couldn't, so we did a video interview of her. And I tell you what, if you want to take your conversations outside, that would be wonderful. It's a very short video, but I also think after meeting with her and talking with her, she's a person who could very well become very much a champion for us. So we're going to just play that video, and then we will be finished for the afternoon. So, want to put it up? Good morning. Good morning. We're talking this morning with Senator Holly Mitchell, who represents the 26th District of California. And I'm just going to share a few of her accolades right now, and then I'll come back to some more personal issues. Currently, Senator Mitchell chairs the Select Committee on Women and Inequality, which I find very fascinating. I'll be interested to hear about that. Okay. She's also on the Labor Committee. She's on the Select Committee on Autism and Related Disorders, which is probably interesting to many of our folks in our audience, and is also on the Budget Subcommittee 5, which focuses on public safety. So with all of that, I want to say that we've known each other for, shall we say 20 years?
I think that's fair. That's a nice round number.
So, Senator Mitchell, I would love to hear from you just kind of what you're doing in, you were in the Assembly, now you're in the Senate. Mm-hmm. I know at one time you worked for Senator Diane Watson, who I thought was a terrific representative.
Agreed.
Why don't you share a little bit about kind of what drives you? What is driving you to do all of this work? Because it is a huge amount of work. I've seen it happen, so I know that it is.
It is a huge amount of work, but it's what I think you and I have spent much of our professional careers doing in terms of creating policy that benefits California. And I think what I'm doing today is just kind of the next step for me professionally, based on what I was doing when we did meet 20 years ago. Our history goes back to when I was working for the California Elected Women's Association.
That's right.
Back in a time when women's health, the only context in which women's health was discussed in the legislative arena was really around abortion. Yeah. And through the vision of CWAR and Kate Carpolo at that time, we wanted to broaden that public policy discussion. And you and I had the opportunity to work together in developing a white paper on women's mental health.
Right.
And we did 4 or 5: women's reproductive health, mental health, health in the workplace, physical health. And so for me, I've been very lucky, knock on wood, that most of my career has focused on the same population and trying to develop public policy that works for California, primarily women and children. So I left the nonprofit arena in 2010 because I got mad.
I was about to ask you, what got you to run for office?
I got mad. The budget cuts, the state was in the middle of a 10-year drought, fiscal drought, social drought, ethical drought. And that manifests in many of the critical services and programs for people suffering from substance abuse, people with mental health issues, really suffered. And I was running a nonprofit organization, providing a critical service for working women, childcare, and just couldn't take it anymore, quite frankly, and decided that we needed people like you and I, quite frankly, folks who have worked in the policy arena, policy wonks, if you will, who have toiled in the field, and spent time in the details. Because I saw budget cuts being made based on a 10,000-foot view of a community, of an issue, and
little knowledge of what it was actually doing to the people.
Precisely.
Exactly.
Precisely.
Yeah.
And so I thought we needed to elect people like you and I who had a deeper working knowledge of the intricacies of these programs. And if I then stepped in and could use more of a scalpel approach, if you will, during those tough times, which I had to do my first 2 years as budget sub 1 on the health side, chair, which is the budget subcommittee in Health and Human Services. And Sandra, I had to sit there through those hearings and hear the parents of adults with developmental disabilities talk about what their life would be like and the life of their adult children if we continue to cut those critical services. But I also knew that I'd have an opportunity with the Affordable Care Act and the recovering state economy to be in a position to help rebuild. So that's what motivated me to lose my mind and run for public office.
Well, thank goodness you did. When I saw that you were elected, I was so thrilled.
Thank you.
Because I know who you are, and I know
you.
your values, and I know what you're trying to do. So it was a real thrill to see you elected.
I appreciate that.
So now that you're there, so tell me, are there any like big kind of health reform initiatives that the legislature is considering right now?
Well, I think that we are on the heels of one of the biggest health reform initiatives of, certainly my lifetime, and that's implementation of the Affordable Care Act.
Right.
And looking at ways in which California can implement it and operationalize that federal policy in a way that works best for Californians. So I was thrilled to be able to vote on a budget this past year that Darrell Steinberg was able to once again infuse hundreds of millions of dollars for community-based mental health services, for critical triage care, because I'm hearing from the emergency rooms in my district about the challenge they're experiencing because there aren't enough mental health designated beds. And so people present in the ER. And so to again be in the legislature in a decision-making position at a point in time where new dollars are coming in, and we can once again come up with creative programming to help versus budget cuts that harm, I'm happy to be here.
Well, it's exciting to have you there. So I'm just thinking with all of this new growth and Covered California, the expansion in Medi-Cal, we're seeing so many more people now covered. When you think about that, do you see a role for mental health and substance use disorders in that larger health picture?
A critical role, and we have to begin to integrate. When we talk about the delivery of healthcare services, we have to begin to think broadly about the spectrum of healthcare services that Californians need, and mental health services and alcohol and drug abuse services are on that spectrum. Fortunately, the Affordable Care Act got that in many instances and has included resources to include it. I represent a district, Mid-City Los Angeles. The district, in fact, where the recent very public display of what happens when people don't have access in their own community for mental health services. The woman walking along the 10 freeway and her interaction with the California Highway Patrol. And that has triggered an important conversation that needs to be ongoing about how we as a society handle, confront, and provide appropriate care and treatment for, in every community across the state, people suffering from mental health. So, Senator Bell has a select committee. Assemblymember Ridley Thomas has a new select committee on mental and behavioral health services. So there's lots of buzz and attention. And my hope is that that can be sustained.
Oh, me too.
And we can continue to have a conversation, not just episodically when we're confronted with videos that draw all of our attention and the news, but when that dies down, to continue to make sure that Prop 63 and additional resources are prioritized and targeted to communities in need.
One of the things that I think you do really well is what you just said, which is trying to look at communities that are either not served well, very underserved. How do we do a better job there? How do we expand our services and do a better job with this very diverse state that we live in?
That's the million-dollar question, and I think it's bringing people together. It's, NAMI South LA, who I have a long history of working with, working collaboratively with the very fragile Community Clinic Association, the Public Hospital Association, and law enforcement to make sure that we're working not in silos. That's the problem. Health, public health, community clinics, everyone wants to work in their silo. But we've got to begin to bridge that. I was very pleased to carry a bill, and I'm bad, I don't remember bill numbers, but it took advantage of an element of the Affordable Care Act to create home health models, like the New Jersey model, where you develop a model that's patient-focused.
Right.
And mental health services are an integral part of that. Our bill focused for California on those experiencing chronic health conditions and the homeless. Folks who, because of their unstable living conditions, oftentimes are most challenged to have experience a continuity of care. And so looking at models, thanks to the Affordable Care Act, like the home health model that brings in all of the key players to come sit around a table and have a conversation about patient Mitchell. And meet all of my needs, be it my mental health needs, my alcohol, substance abuse needs, my diabetes, my cardiovascular disease, whatever it is. And then to have a realistic conversation about why I can't manage my care more effectively because I'm homeless.
It's a little tough to get treatment services.
It's a little tough to maintain your diabetes medication or your perhaps psychotropic meds, if you will, if you're living on the streets.
That's right.
And so to have a reality-based conversation to bring all of those players together, recognizing that it's patient-focused. And so I think those are the kinds of unique models that we have to continue to look toward.
You know, many of the people in the audience listening today are working on doing that kind of work. They're working on integrating their services. And I have been, frankly, really pleased and amazed that even though it's all siloed, different funding sources, different statutes, different regulations, but the managers on the ground are working at getting around all that so they can do exactly what you are suggesting. And that is focus on what is this individual's needs.
Well, the managers on the ground always get it first. It's, government that tragically tends to get it last. And having been a manager on the ground, I think that's why that's my natural inclination.
There you go. That's right.
And having been a manager on the ground, managing all of those individual funding silos, recognizing that collaboration is the best way to get the biggest bang for your buck and to meet the need of the patient, to have a patient-centered approach. We've had a lot of conversation, a lot of press just in this week around mental illness. And this whole notion of kind of removing the cloak. And I have to say that it's probably one issue that has no respect for socioeconomic status,
that's true,
race, class, or gender. It impacts everybody.
Yes, it does.
And so if this isn't an issue that we can build coalition around, get over ourselves in terms of the embarrassment or whatever the issue is, and figure out a way to provide care to, I'm not sure what issue is, quite frankly.
Well, people still are embarrassed. They're embarrassed to admit. What was it? I just saw the article about the Secretary of State, Deborah Bowen, talking about her depression, and I thought, you go. And I was so pleased to see that.
And Senator Steinberg's daughter at 20, to make the decision herself to be open. It's really important. I wasn't embarrassed to tell people when my father was diagnosed with cancer.
Right. It's a different conversation, isn't it?
It absolutely is. And it's something that we have to begin to acknowledge more directly. And like I said, there are amazing champions in the legislature. Certainly Steinberg has been for many years.
He's been wonderful.
Senator Bell is really going to step in to fill those shoes and continue to lead the Senate and be the champion and always raise the issue. He and I both addressed a NAMI gathering for breakfast toward the end of session. And so I identified then that he was the lead and I was going to be his soldier. And so it's an issue that we'll have to continue to address. And like I said, from my perspective, it's talking about health from a very holistic perspective. And I think that's the most appropriate approach.
What we all want to do. We want to reconnect that head to the body, right?
Right.
Exactly.
Exactly.
So do you see other champions in the legislature that care about this topic the way you do, the way Senator Bell does?
Oh, don't put me on the spot.
Okay,
Have me
I won't
name
do that.
names. But I think that there are any number of people. You know, when you see people stand up and speak on the floor, when you see, you know, the dozens of bills that are introduced in this topic area. I think Senator Bell comes to mind because he's chaired the Select Committee.
Right.
Assemblymember Ridley Thomas, I think probably largely motivated by the experience, because we share that section of the district where the woman was victimized, has developed this Select Committee and has already held one hearing. And, you know, when I talk to, as a Public Safety Committee member and on the Budget Committee, when we talk about building new prisons, county jails at the state level, we have to have the conversation about the population, and this issue always comes up. And for my county sheriff in Los Angeles to say that LA County Jail is the largest mental health facility, you know, in the county is tragic.
In the state, probably, which
In the
is
state.
scary.
And that may have been what he said, actually, in the state.
Yeah.
And
It's
so
frightening.
wherever you sit, I sit on public safety, the issue continues to rear its head. And so I think there are a variety of members who are addressing the issue in unique and specific ways.
Well, I'm so pleased to hear that. It feels like we've been in the shadows for a long time, and people like you are helping us get out of the shadows.
Well, and I think it's because of people like you and the folks at today's convening who continue to do the work you do every day to bring the issues to the attention of the legislature. We rely on you for your technical expertise, the managers on the ground, to really help inform and educate the policies we're trying to develop. So it's an important partnership, particularly during the era of term limits when folks have come and gone.
Yeah.
It's really critical that we have this ongoing relationship, be it a 20-year one or new relationships, that we can rely on to get the information we need to develop policy that's helpful and makes sense.
Well, thank you. And I want to just thank Senator Mitchell for joining us today. I really appreciate this conversation.
Thank you.
You know, I always felt thrilled that you were in the legislature, and now I'm even feeling better about it.
I
So,
appreciate that. And I'm
thank
sorry
you.
I couldn't be at the convening in person, but this was a great way to allow me to be a part of the experience. Thank you.
Thank you. I would encourage all of you to meet with Holly Mitchell, because I think that she really can become one of our champions. She says she's a soldier, but we want to get her to move out front a little bit more. So.